Alright guys, let's talk about a little job I knew about but really discovered this past weekend. I took my special needs child to the hospital. It was really just for routine testing. But I discovered this position. I knew about it, but I really just kind of put it out of my mind. To be completely honest with you, it is, and I'm probably pronouncing this incorrectly, please correct me if I am wrong, an ophthalmic technician. Ophthalmology tech. Ophthalmology is, of course, the eyeballs, the eye doctor nurse, as you want to call it. It is not considered a healthcare field, and I don't quite know why. It is considered a physician extender. Don't quite understand the terminology as to why it is a physician extender and not a healthcare field, or it may be a healthcare field and then physician extender is sort of a subcategory. In any case, let's get into what you got to do it and how to go about doing it. So, probably the way that most people do it is they go to community college and they get themselves an associate's degree in ophthalmology technology, and then they take their test to become certified in that field. And that is, of course, an associate's degree, a 2-year program at your community college. My local community college did not offer it. The community college that is closest to me, somewhere around 70 miles away, that did offer it, had it, and it is, like I said, a 2-year degree. You have to take the T's to get into the program at the local community college, and the total cost of the program, 2-year degree, everything out the door, according to this community college, $10,700 for an associate's degree in ophthalmology technology. Gracious, I hope I'm pronouncing that right. That is a hard word to pronounce. One thing that I found absolutely amazing, astounding, it blew my mind when I discovered this. This is also a certification program, and you'll never believe this. I did not believe this. Duke University. Yes, Duke. When you see people play Carolina, Duke, that university, the basketball team, Duke University, offers this as a certification program. It blew my mind, to be completely honest with you. Their certification, it is not an associate's degree from Duke. It is a certification. It is $9,000. And then they had like a little asterisk, and it said $9,000 plus student fees and books. So that's probably going to include something like parking, probably a meal plan, I don't know, with it being Duke. But it is a 51-week program, so 1 week shy of 1 year. $9,000 to get a degree from Duke University. Just mind-blowing. I would like to take it just to say that I went to Duke, to be completely honest with you. You're looking at making, at least locally, $16.08 an hour. That is $33,446.40 per year. And you're looking at nationally, of course my numbers was for North Carolina. Here nationally, you're looking at $17.37 an hour, or $36,129.60 per year. Those numbers are brought by Indeed. However, one of the colleges that I looked up gave a range of $42,500 to $52,500. So that was the school's numbers, the $42,000 to $52,000, and the other numbers that I just gave you were brought by Indeed. I always get my numbers from Indeed, and if the colleges give me numbers, I'll look them up as well. So, what exactly will you be doing? Now, like I said, I found these people at the hospital. They were helping my daughter with various things. So, they do work in hospitals, yes they do, but mainly they work in offices, eye doctor offices, ophthalmic offices. That's typically where you're going to be found. You're going to do the histories and physicals of the patients, ask a bunch of questions. You're going to do perform tasks such as doing the, EMCH or whatever, checking your vision, your distances of vision. And if you are an ophthalmologist or an ophthalmology technician, please correct me on my terminology, as I don't understand your terminology. I don't know it. So please correct me if I get things wrong. Also, please elaborate things that I'm not covering in this video, as this is just a very basic rundown. So you're going to get the history and physicals. You're going to do basic tasks such as, checking the eyes. You're probably going to take a few images of the eyes, as I saw them take images of my daughter's eyes before the physician saw them. So they're going to take various measurements, various readings, various pictures of the eyes themselves. And then they're also going to educate the patients. As many people know, when physicians or providers give instructions, they are typically in medical talk. Normal people may not understand. A person like this, an ophthalmology technician, will come in and put it in regular people terms. I try to do that as a nurse as much as possible, because, the medical terms can be confusing at times. So you're going to educate. You're going to help people with, various tasks that they need to do. You're going to ask them to see the colors in the books, if you've ever done that before. So pretty entailed. You're probably going to see the patient, or at least talk to the patient, much more than the provider will. The provider in my daughter's case really looked at everything and then kind of explained what we were going to do further, whereas the tech was definitely with us a lot more, and in my opinion did a lot more hands-on with my child. So you're definitely going to have hands-on with the patients. Now, there was even one ophthalmology technician up there that explained to me that he even, in various imaging cases, will put a dye in someone, almost like an MRI, put a dye IV into you to see the retinas and things like that. That is quite cool. You're putting a dye in someone, and this individual had that specific certification that they were the only one in the building, or the only one there, that could do this particular type of imaging, due to the fact that it needed the dye to go into the individual getting the image taken. I'm sure there's quite a bit of math involved in that particular job. And he was called a CRA, I believe is the proper terms for it. I may get that wrong. Correct me if I am wrong. Please do so. But these guys went to school for this particular job. You have hands-on with the patients. You report off to the physician, and you can work in hospitals. Upon looking up this career, I found that unfortunately there's only 5 jobs local to me. However, 3 of the 5 jobs were in the hospital that I was at just last week. So, yes, you can work in the hospitals, and you are definitely going to be working with a provider. As you work under providers, you're considered a physician extender. So, it's a great career to get into. Oh, also, I don't know how I forgot to mention this. Even though there's only 5 positions available in my local area at this given time right now, Indeed estimates that this career will see a 16.5 increase. So there will be 16.5% more jobs within the next 10 years. So jobs will open up, especially as people are getting older. As everybody knows, the baby boomers are starting to get older. Eyes go bad as you get older. It's just what happens. So, definitely a career to look into. It pays fairly well. You're going to see patients. You're going to have hands-on patients. And if you can handle it, you're going to be looking at people's eyes, doing drops, and making sure that they can see various different things. I can't handle it. I can't do eyes. I just can't. It's my one thing I can't do. So, it is not for me. However, if it is for you, please go into it. Also, the fact that Duke, you can get a degree, or really a certificate, from Duke is astounding. So, definitely something to look into. Hope it helps. Thank you much. Don't forget to check out the video over here. Also, like, share, and subscribe over here. Thank you much.